My name is Wayne Hicks and I'm the Sales and Operations Manager, so I run the sales team and oversee operation. The MoleMate provides additional information to people that are looking at skin lesions. Traditionally it's been dermoscopy, which is a very bright light source and a magnifying glass. But that does rely on the practitioner's knowledge and experience in order to make certain assumptions about the lesion they're looking at. In primary care, often that experience doesn't exist, and unlike a consultant dermatologist that will be looking at these types of lesions every day, a GP may be looking at them once a fortnight, so doesn't have the relevant experience and knowledge. So as opposed to dermoscopy, this is cystoscopy. So the difference is that this fires a sequence of different lights into the skin and then reads back and provides additional information for the GP. It also there's basically two routes to secondary care. The GP is making a referral, and it's documented that 80% of those referrals are unnecessary. There is also a large amount of excisions that are also unnecessary, and the gold standard with regards to a mole is still to excise it. So it's to reduce the referrals and to reduce the unnecessary excisions. Obviously, to refer a patient to secondary care has a cost, and it's how that cost is met. And potentially with the change to the NHS, where the GP is going to hold that patient a pot of money, if he can set the patient's mind at rest by saying, look, there's no need for that referral because of these reasons, and show them pictorially that it's not a serious lesion, then they're not going to insist on that referral either. So the device now is firing a sequence of different coloured lights into the skin. Okay, but as you can see, that's the colour image of the dermatoscopic image. We've got a melanin view, a dermamelanin view, a blood view, and a collagen view. And as you can see from that screen, there's absolutely nothing whatsoever. But what we can go through is a sequence of questions. So the first thing that we do is to place the lesion on your right forearm. Now, so the first question is, are there any bright dots within the lesion? Well, there's absolutely nothing there at all, but an example of bright dots would be something like this. Now, if I was to say yes to that, it's going to come and say, look, that's suggestive of seborrheic keratosis. It's clearly not seborrheic keratosis, there aren't any dots, so we're going to say no. Next, does it contain a melanin brain pattern? Again, that's an example of melanin brain pattern, and again, that is suggestive of seborrheic keratosis. So we're going to say no again. Are there any blood lacunes? Again, there's absolutely nothing on the screen whatsoever, but a blood lacune would look something like that. And again, that is suggestive of hemangioma. So that's another no. Is there any dermal melanin within the lesion? Well, again, it's a blank screen, but an example of what we would see would be something like this. Again, we will say no. Are there any blood vessels? Again, it's absolutely clear, but if there were any blood vessels, it would look something like this. The first thing a lesion is going to do, a suspicious lesion, is set itself up a blood supply. So again, we're going to say no. It's now asking us, what's the size of the lesion? Now, clearly that's not bigger than 6 millimetres, but if we were in any doubt, we can measure it. Okay, and it's not. So we say no again. Age of the patient, between 16 and 30. Lesion score is 1. So the range goes from 1 to 12. Obviously 1 being the lowest, 12 being the highest. If it comes up as 6 or above, then it's suggested that you should refer to secondary care and have a look. Requires perhaps further investigation. In this instance, there's absolutely nothing whatsoever. Now, from a GP's perspective, the GP could involve the patient in that process and go through the same analysis, so that's what's setting their mind at rest, because they can see that the GP is saying no, 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 no. So they're going to be less anxious about what that lesion potentially may be. What we can also do is generate a report which can be either attached to the patient record because it's a PDF. It can be printed out and given to the patient, and that will give all the relevant details: where it was carried out, where the clinic was, who the patient is. It'll also contain images at each stage, all through the melanin, the dermamelanin, the blood flow, where the lesion was and what the relevant score was. And that's the MoleMate.